Hi, my name is Daniel Dieter from Southern California, and I'm here today to tell you a short story about my experience with EmCell, a very interesting company located in Kyiv, Ukraine. Several years ago, I had ignored doctors most of my life, actually up to age 65. I barely saw a doctor, and at that point I had what you call a medical meltdown. I had AFib, I had a TIA, I actually had a hernia, and all in 1 year I also had a detached retina. At that point I started doing serious research because I felt that there had to be some way to kind of regain my health and hopefully reverse or maintain the aging process so I no longer would be subject to this kind of life-threatening surprise. Basically what I did is I talked to friends, and a couple of friends said there was this new technique with stem cells and they were telling me I should research it. So I went online and I carefully researched several different techniques: adult, cord, fetal stem cells, and I found out there's some very interesting things that based on testimony and research that made fetal stem cells a bit different from the rest. They had the ability to home in on various parts of your body that were not quite healthy and actually do some repair work. The other advantage, they were young cells, and these young cells would last quite a bit longer and do a better job than the adult cells, which could repair specific areas, but generally had a shorter lifespan. And as I was looking at anti-aging, this seemed to be a technique that would work for me. And after carefully researching 4 or 5 different fetal stem cell companies, the one that impressed me the most, that was outstanding the most, was EmCell, because they had patents, they had published articles, they had case histories dating back in the early 1990s, and they had over 600, actually 6,000 cases, and there were no apparent negative side effects, and it looked like they had, more often than not, a very successful treatment for the specific purpose. I also was impressed with the depth and breadth of the areas that they could treat. If you went in for one specific reason, they tended to also have very many positive anti-aging side effects, tend to increase your overall feeling of wellness, your immune system. And in my case, when I had the treatment in August, since then I have had no heart problems. I didn't want any more medication. What they did to me before had very major side effects. I felt groggy, I felt foggy, I didn't feel good. And I've been off of that medication for the 6 months, and I'm able to exercise much more substantially now for a longer time at a higher heart rate. And the other side effect, they advised me that I wouldn't need as many vitamins or supplements, which I took a lot of, and that I also was on hormone therapy treatment, and that I could discontinue that after careful monitoring with my doctors. And at this point I'm off of all medications, all hormones, and I'm feeling much better in terms of my ability to perform athletically. I feel better in terms of mental alertness. My eyesight overall is slightly better instead of deteriorating, seems to be getting a bit better. I understand that many of the benefits won't come apparent till a year or longer. The other good thing about the treatment is you don't have to do it every 6 months or a year. Because these are young cells, they survive, they actually are stored in your body, and they become available as you need them. And they also, based on my understanding, fix or assist your organs where they can be much more effective for a number of years. So if I was going to do, say, what we call a top out, I'd probably come back in 2 to 3 years. Now that's different if you have severe cases, and that's the one other thing I've had that we actually witnessed while we were at the clinic. An MS patient come in, and she has come back because she had a relatively severe case every 6 months. She has come back, but she went from not being able to walk for playing volleyball, and I personally talked to her. It was an amazing story. When she had the MS, she was 18. At 23 years old, she was playing volleyball, dancing, and personally meeting her was a great Christmas present. And the other thing that I would want to emphasize is that stem cells for anti-aging, you should do it before you have the problems I did. It is much more effective. Don't wait for the symptoms to occur. Get a review. And a woman, if you're over 40, if you're a man, you're over 50, I would suggest that you seriously look at this as an anti-aging and a prevention treatment, and a treatment that will allow you to function more effectively rather than wait for a medical catastrophe, as I had 3 in 1 year. And that's my story.